Well, this week we're going to go over low back stretches. Why? Because Ellie from Boston contacted me and she had some questions about her sciatica, full-blown leg pain, and she should do the Mackenzie's, the back exercises, or the Williams, the knee to chest exercises. So I talked to her, we did a consult, but now I'm going to show you what I want to do, but everybody can benefit from this. However, you have to talk to your doc about your exercises. You have to consult with somebody that can look at your tests, can take a look at your physical body, do an examination to find out what you really need, and is exercising the right way to go for whatever condition it is. Is chiropractic adjustments the appropriate modality? Are rehabilitative procedures? Is diet good for you? So you got to check with your doc. So I'm all about sharing information with my subscribers, but you got to be thoughtful about choosing to do the right thing. Don't just self-treat because you have the knowledge. Work with your professional. Now, with that said, we know we're dealing with sciatica today. So we're going to talk about sciatica. We start off with stretching first. Now, beyond stretching, current research is showing that motion, mobility, movement is better than complete bed rest. So if you're having that leg pain, get up and move. You may need to use crutches. You may need to use a cane. I had a patient come in with a baseball bat one day, using it as like a cane. Get the weight off of it, but get moving. Summertime, get in the pool works great to get and do exercise in the water. But motion's better than rest. So as soon as you can move, move. Next, stretch before we strengthen. The goal is to open up the disc space and get it off the nerve, whether it's this way or this way. We talked about it in my other exercise video. So let's start with knee to chest. Mike, say hi to everybody.
Hey.
He's the guy. I want to be like Mike someday. So knee to chest exercises, both knee bent. First progression is grab behind the knee and pull. Does it really open up the lumbar spine? Guess what? Current research is showing this is really mobilizing the hip. But by mobilizing the hip, it's taking the pressure off the lumbar spine. Second progression, knee to chest. This leg goes straight and pull up. Hold for 30 seconds, 3 times each leg. No pain, up to but not through the point of pain. If that's good, you can do a double knee to chest and pull. That gets a little more authority higher up, so you do get some motion in the lower back and in the lumbosacral, where the ribs end, thoracolumbar region. That's your progression. When that feels good, we add the figure 4 piriformis. Mike, cross it over, figure 4 position, grab behind this knee and pull. You see how he relaxed his head? Very, very important. Don't hold your head up. It'll make your neck worse. Nice stretch for the butt. Again, no pain, 30 seconds, 3 times. That's a nice series progression for knee to chest. If that makes you feel better, do those. If that doesn't make you feel better, flip over. Let's try some extension exercises. Now, with Ellie, she was having leg pain down the right leg, so I told her to shift her legs off to the left. That oftentimes will unload the disc in the lower back. So by taking the pressure off that, legs to the opposite side, try it. Prop up like you're reading a book, Mike. That's number 1. It's a stretch. Hips stay down, feet are off to the side if you're having sciatica. Lie back down, 30-second hold. If that's comfortable, feet go in the middle, prop up like you're reading a book. Hips stay down. It's not strengthening. This is relaxed. It's to open up everything from the front. Opens it up, creating a negative pressure to suck the disc forward. Mackenzie was the one that developed this. If that feels pretty good, it's a progression like everything we do here. Push-up position. Try to push up with your hands. Stop right about there. Halfway first, relaxed. It's not an active contraction of the muscles. 30 seconds. Go back down. If that's good, come up a little bit higher. Come up as far as you can. Elbows straight. Cobra position, they call it in yoga. Hips are down, all right? You're not lifting up, keeping the hips down. Relax. Again, sets of 3, 30 seconds. When that gets easy, now we can start thinking about strengthening a little bit. So I do a combination. Slowly lift up, actively, and he gets that far, he can't lift anymore. Then push up into the press. So it's an active contraction right into the press and go back down. So show it as one smooth movement, Mike. Lift up and then push right into the press and slowly go back down. Then you get there, you pull away and go back all the way. So you get a little active contraction. End range movement, that last little, show me just end range extension, Mike. Just arch up. That can be very beneficial in the subacute phase, not where you're inflamed, all right? It's not a full back extension, it's end range extension, a whole nother subject. So, there's your ticket, that's the deal. You're having sciatica, try these exercises, and thanks for subscribing. I appreciate it. Keep subscribing, keep watching. However, talk to your doc too to make sure you're doing the right exercises. Have a great day.